Hi, everyone, and welcome back to another episode of Chats with Your Advocate, where health literacy meets real life. I'm Tiffany James, the owner and founder of Divine Wellness Partners. So if you're new here, welcome. And if you've been part of our community for a while, thank you so much for being here and trusting us. We get so many questions about what patient advocacy is, how our business works, and whether we're like home health or therapy. So people also want to know how they can actually access our support. So today I'm going to be answering some frequently asked questions, explaining the mission and vision, and sharing what's next for Divine Wellness Partners. So, quick disclaimer before we dive in and get started. This chat is for educational purposes only and does not replace medical advice, diagnosis, or treatment. Always consult with your healthcare provider before making any decisions regarding your medical needs. So, what is patient advocacy? That is the big question. That's why we're here talking. So, patient advocacy, as we define it as Divine Wellness Partners, okay, is about support, clarity, and empowerment. It's helping people understand their health, their options, their rights, and then helping them navigate or move through a healthcare system that often feels overwhelming, fragmented, and disjointed. So we help bridge the gaps in that care and your goals. We help translate medical language. We help coordinate care and prepare people for conversations with their healthcare providers. And most importantly, we walk alongside you, not the healthcare system, so you're not navigating this alone. We focus on the goals that you have for your health journey. Divine Wellness Partners is a nurse practitioner-led advocacy and care navigation practice. We don't replace your doctors. We support them. Our role is truly complementary to the care that you're already receiving by helping you with things like understanding diagnosis and treatment plans, helping to coordinate between providers, navigating insurance and benefits, and maybe it's a caregiver who needs support. We do that as well. So a big part of that is through health literacy. We also focus on community engagement. Those are big parts of what we do. Because as a whole, understanding your health shouldn't be a privilege, it's to be a standard. So we recognize that there are barriers in the day-to-day, so we step in. Now, I created Divine Wellness Partners because I saw a need for someone who could sit in the middle between almost the micro gaps in the system, right? Between the healthcare system, the resources that are in place, the providers and the patients, to try to make sense of everything. We found that most of the members of a healthcare team are trying to help, but the challenge shows up after the visit, right? What happens after the office appointment or the home health visit or the ER trip or even the hospital discharge? When the encounter that's limited by time with your provider wasn't enough time, or when the issue that falls just outside of that standard of practice and care actually becomes a real barrier to your day-to-day care. So for me, this work is deeply personal. I've been the provider. I've been the advocate. I've been the loved one searching for answers. And I've also been the patient who learned firsthand how critical advocacy, health literacy, and having someone in your corner is. It's very important. So Divine Wellness Partners exist because people deserve clarity, compassion, and support, not confusion and burnout with the health system. Now, understand that I don't do this work alone anymore, right? So I have Dr. Sandra Graham. She's now part of the Divine Wellness Partners team. She is a licensed clinical social worker and a board-certified mental health advocate. She's our trauma-informed expert with over 20 years of experience. Her work focuses on helping people feel seen, heard, and supported, especially when navigating mental health challenges, life transitions, and emotional stress that often go hand in hand with medical complexity. So together we take a whole person approach because physical health and mental health, as you know, are deeply connected in most cases. So when we talk about insurance and how our calls work and accessing support, That's something that we do get questions about. So for me, I do accept select insurance plans as a nurse practitioner. We do also offer private pay options depending on the type of service. Every situation is different and we recognize that. So we always start with a quick 15-minute discovery call. That call is designed to be a simple conversation so that way we understand your needs, answer questions, and see how we can best support you or your loved one. So even if you're not sure what kind of help you may need, or if you even need advocacy, that's okay. We'll figure it out, and by the end of the call, we'll know a little more, okay? So let's talk about what's next for Divine Wellness Partners. Definitely continued growth in education, community engagement, and advocacy support services, both one-on-one and in community spaces. Our mission will remain the same. We're improving health literacy, empowering self-advocacy, and meeting people where they are for care navigation and personalized advocacy support, okay? So let's talk about this, right? If this chat was helpful in shedding some light on what we do, please like, comment, and subscribe. It truly helps us reach more people who need this information. Drop your questions in the comments. We use them to shape our future chats. I want to know your thoughts. I want to know your questions. Understanding that advocacy and what we do is very individualized. If you have specific questions, please, you can schedule that free 15-minute discovery call. The link will be in the YouTube description. And just leave with this. You deserve to understand your health, and you don't have to navigate it alone, okay? That's why we're here. Until next time, this is your Chats with Your Advocate. Have a great day and take care.